All right. Welcome once again to the webinar Wednesday from the Learning Communities Resource Center. Today's title is You Can't Get There from Here, or Can You? We're going to be talking about creative strategies for rural transportation access. We're very fortunate to have with us Robin Phillips, representing and leading the team from National Rural Transportation, and she will tell you more about her organization as we go through the pieces today. Some folks are saying they can't hear if there's any sound. Let's see. Robin, can you hear me?
Oh.
I just unmuted you.
Yeah. Okay, yeah, I can hear you.
All right, we are having several folks who are saying, is there any sound? Someone said you can only get it through calling in. You should be able to get it also through audio connection on your computer. If you, on the left-hand top of the screen, click on the Communicate tab. And Amy, if you would do me the great favor of typing this in the Q&A, you can switch audio to your phone or you can connect audio through the computer. Okay, we got a couple of people saying hearing through the phone connection. So if you click on Communicate and then switch audio and say, I will call in, it will help out. We'll get that typed in, and then we're going to keep going with the presentation. So we are terribly glad you make it. We hope that we can sort out any audio issues in short order. As you know, everything that we do starts and ends with the promise of community action in terms of who we are as a network, what we believe in. So we like to start all of our events by reciting the promise. If you would do that with me at your desk, that would be terrific. Community action changes people's lives, embodies the spirit of hope, improves communities, makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. Thank you all. I'm getting some messages that if you click on Communicate, it's working, and it's working fine through some computers. So I'll just ask everybody, if you are having trouble, please click again on that Communicate tab and select your audio source. So as many of you know, the learning community at the Community Action Partnership has a very specific purpose, and you see that purpose here on the screen. What we're really doing is looking at outcomes, and not just community action, but looking at our outcomes, identifying effective, promising, innovative practices that can help really fight the causes and conditions of poverty. And to do that, we bring in experts in different areas. As some of you know, I did one last week on resource development. We've done things on whole family approach. Today, and we had a great number of signups. We're very excited to see so many people with us today. We are over 100, so thank you all. But today we're talking with subject matter experts, as I said, Robin Phillips, to talk about rural transit. I know, having written many a community action needs assessment or community assessment, transportation is always on the list of needs, particularly in rural America, which is what National RTAP specializes in. So we're going to hear from that today. Robin and I will have a conversation. We'll bring your questions in from the chat as well to be answered, and we'll go through this next hour, hour and a quarter. There's our team pictured. Today's agenda, we're going to have some introductions and some questions for you. So get ready on the chat window. Talking about the vision, your vision for the community. How you figure out action steps. Who are those aligned agencies? What else is going on out there? There's a lot, but it may or may not be directly connected to your community yet. We've got some tips on that. Thinking about your planning, assessments, which includes your own community action, CSPG assessment, transportation assessment, focusing on HAP Cap, one of our Ohio CAPs who's done some phenomenal work in this area and has graciously shared some materials for you. And then, yes, there are grants for this kind of work. So we'll be talking about those as well. Now I'm going to take the ball and pass it over to Rob, and she is going to pick up with the content. Robin, take it away.
Hey, thank you, Lindley. This is great. Thank you for having me here today and giving me a chance to introduce you all to our resources, because we're here to help you if you're in rural communities, and for us that means any community under 50,000. But even if you're in a larger community and you're looking for ways to connect in and get smaller people from smaller communities into your service centers. That's one of the issues that we deal with, and I know you deal with, is that consolidation of services has stressed our transportation resources even further. So we're going to talk about that today and ways that you can take baby steps and bigger steps to support transportation improvement. For this program, we are going to do some introductions. I'm going to find out a little bit about you. You're going to find out some more about me. We're going to talk a little bit about what you're dreaming of or how you envision the transportation for your community, because it's really important to have a vision before you can implement it. And then what are some of the immediate steps you can take to identify aligned partners or aligned organizations, needs, so the assessment piece, and resources to help you identify resources for moving forward. I'm with the National Rural Transit Assistance Program. We're fully funded by FTA. It's about 4 of us, but we are a web portal and also in person, and we provide training materials if you do transit. We help with customer service, compliance with federal rules, grant development, and really are here to answer your questions as you start looking at ways that you can engage. We work specifically with tribal and rural project development, and in some of the grants, public-private partnerships are key to making those connections. You, who are you? We have the chat box here, and I'm really interested in hearing why you're here today. Like, what is it that you need to hear from Lindley and I to help you get what you need out of this webinar? And please go into the chat box, share your ideas, and share your interest, because I am, this is great. Alex added her idea in, or his idea in, and we'll try to hit that issue. And the other thing is, have any of you had an experience with transit that you really liked, that was easy, or it was fun, or it surprised you, or you would love to be able to replicate that experience in your community? And sometimes it sounds crazy because you were in Europe and everything connected and you were in the middle of nowhere and the bus came by regularly. Well, that's a great thing to have happen, and it does happen some places in the U.S., but it's important for you to have an idea, if you have an idea about a good experience, what made it good? Was it timely? Was it comfortable? Was it easy to pay for? And you understood what the bus was doing? There's so many elements to a positive transit experience. It's important to think about the things that really engaged you. Mm-hmm. So we're going to talk about that a little bit today.
Robin, I've got a few coming in for the chat box that might be interesting just to put in the mix. And I won't try to read everyone, so don't think I've skipped folks, but some of them are very similar in the Community Action Challenge. We have a very limited rural transit options in our county, interested in expanding them. Van coordinator. This is really what we're talking about, how to get people around in rural, really rural areas where there is zero public transportation, zero Uber, Lyft, and very limited funding. That one who has a van up and running through a county grant, but they need volunteers. We are going to be talking about volunteer drivers. She specifically says under age 70. Developing a transportation plan. Hoping to learn more ways to connect with existing services. Oh, a nice experience from Alex. A bus line was expanded near the house. The bus expanded stops and now comes every 10 minutes.
That's great. These are both really good.
Yeah, small rural transit. Let's see. Systems designed through regional commissions, how can we make them work for us? York County Commission out of Sanford, Maine, participating to learn options or avenues we haven't pursued or thought of. Southern Kentucky in Bowling Green, haven't started one, but here to learn. All right, I think I'm hearing a lot of good things coming in. Under age 70 is due to the county's insurance policy.
Well,
all right, so this is exactly what we're here to talk about.
Yeah, and that under 70 comment actually is really good because often in rural America, the volunteer, the pool of volunteers may be older than 70. You may have a group that are younger, but oftentimes you have volunteers who are white, elderly. They're good drivers. They've been doing it for a while, but I understand, I think it's important as you do to understand what your insurance environment is. And that would be a whole nother webinar. Lindley and I can do this again. There's opportunities for nonprofit insurance pools. That would be another thing entirely, but you can call us and we can help connect you. So one of the things I wanted to start out with is that vision statement. And I think one of the things that I heard in your answers in the chat line is understanding that you may not be doing everything for everyone. And I think before you get started, you have to think about what you're able to do for who and when. And one of the reasons is because we would all like more transportation and the bus that comes right outside our house and it comes every few minutes. But that won't happen. So especially in rural areas, understanding what the demands are and what people need or what is the highest priority for your program is key to helping you create a successful response. Because our goal is to have the system that you have be as responsive and continuously responding and adaptive as your community changes. And sometimes if you're doing a volunteer program, you may not have accessible rides for all your trips. So how are you going to mix accessibility and access to actual service? And understanding how potentially having a volunteer program may have restrictions or limits if you're around vehicles and accessibility. Another thing about having a vision is you may not want to think that we're going to have limos to pick everybody up. However, it is good to think about, well, if we were able to run service that met people's needs without thinking, oh my gosh, we only have X dollars. So I think that you have to find that balance, but it's important to understand both how much you are able to invest in the system and how much do you want someone to pay for it. And with a taxi, people pay the full fare, and maybe if you buy down a taxi, you will reduce that fare, but it still might be too expensive for someone who, if they have if they're getting dialysis, they're going 3 times a week. So you have to balance your objectives and your resources. And that doesn't mean you can't have fun. I think it's very important. It's very important for people to access services, food, nutrition, healthcare, their friends. But that doesn't mean you have to be not having fun doing it. In Colorado, when they started doing their little shuttles around town, it was in Boulder, I think, they had the Boulder, and they named their routes Hop, Skip, and Jump. I know another service that named all their vehicles, and so they had like Stinky. So in some ways, it's not that you have to be silly about it, but you have to think about how you're opening up your system to people using it. Because even if it's there, if people feel like it is not something that they want to have as part of their identity, they may not want to get on that bus that they desperately need. And also, when you're doing the vision, it gives you a chance to share that, and so you can all know where you're going. When you're looking at understanding, improving your transportation area, or improving transportation in your area, think about your demand partners, other organizations, agencies, or potentially destinations like churches, schools, grocery stores, retail, where they need people to come, employers. They're trying to get people to get to their programs, healthcare organizations. Supply partners, there may be a taxi in your town. There may be a senior shuttle that comes out of the AAA. You may have Dave, who does Disabled Veterans of America, or Disabled American Veterans Shuttles. They aren't going to meet all needs, but they do meet some needs. And so looking at that pattern, looking at the whole host or list of people that are able to help you, or able to provide some part of the transportation network in your community. And then, as you know, you have an annual planning process. Everyone has a different process, so that if you are looking at improving transportation, you need to understand what the funding process is for transportation in the area that you live. And the thing, we're going to talk about this a little later with the federal grants for transportation, but one of the basic things about public transit money is it flows from the feds to the states for rural communities. And the states have a lot of discretion in how that money is allocated and the timing for that. So I'm going to give you some hints later about how you might engage with this. One of the things I also look at is how do you look at what is the transportation system you need in your area? And one of the ways I look at it is as a travel shed. Where do you travel in a year? Your clients come in and they have to get to your program, they have to get to the doctor, they may be going to work, they may be going to school. Each of those areas that each of those destinations are a point on a map. And if you add up all those points in a year, that would tell you what that personal travel shed is. And if you add all of those travel sheds together in a community, you have basically where the community is traveling in a year. And most of you understand, and it's often something you run into in rural communities is when you start looking at public transportation, people are looking at the city or the county. And almost no one lives their whole life, a whole year, within the city or within that county, especially in a rural area. So it's important when you're thinking about a transportation program or improvement that you think about where people are actually traveling. So this is something that we have run into, and we have looked for ways that as a program you can say, well, yeah, we want to help everybody get where they need to go, but we can only work on the part that helps them access our services. Or that's all we can work on right now. And one of the ways we assist that is helping small transit identify the actual cost of that service, and so that they can say to you, well, if you want people to get to your service twice a week, once a month, this is how much that level of access costs. And that's an important part of being able to partner, is understanding what that partnership actually costs, because then you can start looking for the resources. And those resources can be grants, which is actual money, or they can be people, someone that can answer a phone, someone that has experience writing grants or dispatching, or institutional, that you can handle federal funds, or that you're able to provide space where a mobility manager or a person from the transit agency would be able to sit and interact with your clients. So these are some examples of demand partners, supply partners, and some of the processes. And I pulled out the transportation particularly. State DOTs usually have transportation plans by area, potentially by county or city. Coordinated transportation plans are the plans that look at the relationship between human services and transportation. So they are the best chance for you to get your client's needs or your program's needs into a transportation plan. And we have an example of a transportation plan from Athens County. They have an Athens County Coordinated Transportation Plan. And Jamie Smitzer from Athens County, she's the Athens County Mobility Manager, is part of the CAP. And she's on this webinar, so if you have questions for her, you're welcome to put those in here too. Let's see. So
let me jump in, Robin, if I can, for just a second. I want to just ask a quick chat window comment. It looks like we've got most audio issues resolved, but if we do not, please do those in the Q&A box for us. Technical issues. But in the chat button, I'm interested how many of you are actually working, as Robin was describing it. And just see, because if you're not already deeply involved in it, I hope you're already referencing it for your community assessment. And I know in some places there might not be one. But if you could, just spend a second in the chat as to whether or not you're engaged with transportation plans. Robin?
Yeah. So I'm going to just connect this. Let's see. Copy. I'm going to put this in the chat. This is the link to this map. Enter. And this map, you can scroll into it, and it shows you all of the existing intercity links. And you can see, looking far out, that even in some very rural areas in North Dakota, Colorado, Arizona, Utah, Idaho, Eastern Oregon, there is a significant transportation resource available, and that is because of these public-private partnerships between communities, public entities, the state, and private operators. And the FTA has a program that really supports that and provides assistance on creating longer distance connections, so regional connectivity. And so I wanted to make sure that all of you could see this, because from my perspective, this is our existing intercity bus and train network. And so this is the spine that we can work with and develop from. This is an example. These are communities that do not have, they're 25,000 plus, and they are without intercity service. Sorry about that. Anyway, these, I took this picture so that we could get, you can see these are places that are high priority intercity access development. These are places where it would be, you would have a good chance of creating rural connections or regional connections, and the states have resources that are focused on that. So I wanted to make sure that you guys saw that. There's also a map of the national these are fixed route transit systems around the country, and you can go in with this link and see what's around you in your community. The green dots are ones that have agreed to share their information through the U.S. Transit Map, which is part of the Bureau of Transportation Statistics, BTS. The white ones are ones that are in Google Transit so that you would be able to see that. And these programs, you can see even in fairly rural communities. This is Colorado, New Mexico, Missouri. You are looking at quite a bit of public transportation, and that means there are GIS layers, GIS information that is available to you or could be available to you by working with those entities. Kansas, Nebraska, they have the states have taken a leadership role in getting their transit systems into Google Transit. The Census Bureau has a really cool program called On the Map, and I've used this to look at, wait a minute, where are people going to go to work? How far are people traveling to get to a job? Because when you're thinking about putting together a new shuttle, you want to be able to look at what potential other demand is there to support you. And in the case of Athens, you can see that Athens has a high density of jobs, but right outside Athens is another community that has high density. And it seems like a very clear need that you would want to make sure there were connections between Plains and Athens. Another way that you can improve access to your programs or the programs in your community that need higher level of access is connecting your website to the transportation that's available. In one example, can you hear me?
Yes, yes, indeed.
Really?
Yes.
Okay, good. Okay. So this is an example for HRSA, and on the HRSA site, you can go in and they have a locator and I put in Athens, Ohio, and this is what came up. And I identified Athens WIC Clinic is where I wanted to go. And when I clicked on it, it gave me access to their website or directions. And this is what I got when I clicked directions. It gave me how to drive there. It gave me how to catch a bus there. And it told me how to walk. That didn't cost HRSA any money. This is what's already sitting in Google Transit. It's an API that you could frame up on your website, and people who are trying to get to the food bank, trying to get in for light heat services or housing services, that can fit right on there, and people can click it, and you'll get itineraries for accessing if you have transit in your community and it is on Google Transit. Getting into Google Transit also does not cost your transit provider any money. It costs time and it costs understanding. And that's one of the things that our program can do is give you access to spreadsheets that need to get filled out and technical assistance to develop the information if you have a transit program to get your transit into Google Transit, and we can help you with that. The other thing to do as you're looking at how to respond to needs is see if there is a plan. That Coordinated Human Service Transportation Plan I was telling you about can help you see how other organizations and the transportation resources in your community see the needs in your community. And if you don't see what your needs are in that plan, call them up. Call up and say, oh, wait a minute, I just saw your plan, and we are not getting our needs met. How do I work with you to get our needs on the table? Some plans have a list of projects. Some plans, like the Athens one, has priorities, and they have some information about the projects that are the highest priorities. Look out who is on the committee. Get on that committee. Send a letter to the committee. These plans are here to reflect needs in the community and identify resources and identify projects that might help those resources. So these committees are here to actually capture what you want to say and what your needs are. Find out when the next update is and how to submit projects.
Robin, if I may?
Yeah.
I just want to tail on here exactly at that point. Thank you so much. Gang, many of you we've seen in the comments are actually involved in these plans, but of the 117 some people online today, many are not. And so I want to really encourage you, if you're not already using that plan, the transportation plan that we're talking about, as part of your community assessment, you're missing a boat. But they're going to be just as eager to see your assessment if you're not already partnering with these folks. They're going to be as eager to see your assessment of needs in the community as theirs. This is a heck of a way to begin the partnership, is you can bring your assessment to the table as well as discussing theirs. And they'll be almost always extremely open to that.
Yes.
Back
and
to you,
people, you're not out there alone. And I saw someone ask about the BTS tool. The slides have all the links on them so that when you get the slides, you'll be able to access that BTS link. And this is the opioid misuse tool on the USDA site. And it has an amazing, basically, community analysis. So it doesn't just look at the fatalities by opioid deaths, but it does look at what the makeup of race and ethnicity, age, education, disability, median household income, poverty rate, unemployment rate, and accident-prone employment, which basically has to do with people who potentially could be on pain medication. And so what is a susceptibility? But it is a really great tool for kind of looking at your community and the whole country from that perspective.
Mm-hmm.
And if you are thinking about engaging with transportation and transit and you haven't before, the first thing to do is find out who your closest transportation or public transit operator is. You may know. It may be the next town. It may be in your community. If you don't know, the state DOT can help you, and you can check in. The first link I have on here is to the Public Transportation Council at AASHTO, the American Association of State Highway and Transportation Officials. It has a Public Transit Council, and there's a list of the state DOT people who are who work with public transit in the state. You can also go to our website, the National Rural Transit Assistance Program, and we have a directory of state training program managers, and they can connect you with who within the DOT, and they can probably tell you yourself, you themselves, what is the closest transit to me? Because it may not show up on that map because it's demand response. I would encourage you at whatever level the transit is in your community, whether it's got fixed route or is demand response, to work with that public transportation partner, because transportation, just like all of your federal programs, is a very complex area. It has a lot of safety, grant programs. It has its own little culture around transportation. So looking at connecting with that transit partner is a way that you can bring your resources to the table and have it go into transit and not into reinventing the wheel, if at all possible, because there is a lot of regulation and training around this. Once you find that transit who is the closest, or you potentially are that transit if you're like HAP Cap or some of the other agencies, how can that agency work with you? They may not have any more resources. In fact, most transit agencies I know of do not have anywhere near enough resources to meet all the needs in the community. But they may have ideas for strategies that you can implement. Earlier I talked about just framing up the existing transit app for Google on your site. There's other things that can help people access transportation, and you can also find out what their ideas are and bring to the table. You can talk to your clients about their transportation needs. You're able potentially to support travel costs with program funds and assistance with writing grants or letters. You can help them get more resources into your community. And obviously, coordinating or convening partners is a very important part of improving transportation. I've added in these simple, you could just ask people if you're trying to get information about medical needs, medical transportation needs, or educational, just find out how people are getting to their programs now. I would point you to the HAP Cap Plan. In the back, they have they have several different surveys that are available depending on the type of market. So whether it's senior, people with disability, general public, students, these are all different. There's different surveys out there for you to think about for your program in your area. Transportation is a system, and it's not just a program that goes away. It has annual allocations, but when you're looking at developing transportation, you're looking at, in a sense, you would look at it like plumbing, where you want something that works for you, but in order for it to work for everybody, it has to connect to the larger system. And I showed you that intercity network. That can be a part of your regional connectivity. It may not and probably will not meet all your needs, but it exists and it's there, and people who are doing intercity transportation are often interested in helping you create that access to their system. So it's an important part. Yeah.
No, that was an involuntary, yes, highly in those connectivities, because it is so much easier. We know this in community action, to build on what exists, even if it exists in the next town or the next county. They're going to be eager to see, and folks, I know many of you from the chat are actually working on transportation plans and running transportation programs through your agency, your CAP. We have a lot of folks on from counties. So please, if there's advice you want to send in through the chat window on how you like to be approached, in terms of expanding into neighboring areas that are or underserved, please feel free to put that in and we'll read. But I'm with Robin, and I cannot emphasize enough how important it is to make that connection. Even if your area is unserved, somewhere out there, there's an area that is served. And, at one point I worked in Kalispell, Montana, and the nearest transit system was Missoula. Okay, that's all right. You can move it forward. And sometimes it's senior or medical only. Again, they're in existence. The best thing to do is start that relationship.
Yes. And if they aren't able to help you by helping manage that federal grant, they can be a great mentor and great at sharing information. So each state sort of puts out they receive the appropriation annually, usually about in February, and they have different ways or different calendars for soliciting and allocating funding. but you need to connect with them. This is the rule that transit agencies are working under. This is the guidance for the 5311 rural area formula. 5310 is the enhanced mobility of seniors and individuals with disabilities, and that's more focused on program transportation. You can use it as part of a coordinated plan to develop general public. It can finance mobility managers like Jesse at HAP Cap. It is a very flexible. It is not just rural, though. It is urban and rural and tribal. The federal money that we work with at FTA has three types. It can be capital, admin, or operations. And if you get a grant for 5311, the general public, you can decide often, though some states make a decision on what you can use it for. It comes to them undifferentiated. And in your project, you'll purchase a bus, you'll administer the grant, and you'll operate the bus. And that would use all different types all different match rates. The match, federal agency grant money specific to an agency, CMS, HUD, workforce development. With each federal agency, there is a relationship to the federal. It's a one-on-one. We have some agencies that have agreed to provide allow their funding to be used as match, and some who haven't. But it's something that we can help you with. Call us. We can help you identify these different resources. And the in-kind, if you have a person or you're providing space for someone to sit that's part of the transit program, that cost is an in-kind cost of the project. There are...
Let me just add one thing there. Check in your state, folks, with CSBG particularly. There are some things, I know generally it can't be used as match for federal. There are exceptions. And particularly, supporting those programs. Check with your state offices. It's important. But I really want to highlight that rather like Head Start, for those of you who have it, the transit funding, the 5310s and the 5311s that Robin has been discussing, they absolutely accept that they need to help you pay for buses. They accept they need to pay for the administration of the program. They accept that they're going to continue to pay for those. Those match rates are standard. In the third year, you don't say how you're going to have to support it without them. Transit accepts that this is not going to be sustainable without their support, particularly in rural areas, and that this is going to be really important. So as you get into it, your sustainability planning needs to take that into account, that there is a continued stream of support for the program, whether it's the 80-20 for buying buses and administration or the 50-50 for operating. It really is doable. I am telling you from here that if Sanders County, Montana can get started with a 5310 when there was never any transit, you can do it too. You really can. And that is one of the neat things about the partnership that we sort of accidentally stepped into with National RTAP. A mutual acquaintance said, hey, you guys really need to connect more at the national level, and these webinars were birthed out of that. Robin's organization, National RTAP, exists to help with this. That is their purpose. They are funded for that purpose. That's what they do, is TT&A for transportation, rural transportation. Her contact information slide is coming up. And as we mentioned, we will be posting those slides and the recording. They may be very sorry they got into this with us, because I know this is a key need for most, if not all of you. We are so excited. I'm going to go back to the presentation. We're not done yet. But I really want to point out, you're not in this alone, right? This is your introductory webinar on how to do it. When you get your feedback form, letting us know what other things you might want to talk about will help us target upcoming webinars or sessions. and reaching out to Robin directly is just fine. We have one comment there that I'm going to relay. For some, as a subrecipient, it's based on competitive grants and makes it challenging. Yeah, subrecipients, Rob, you're right. That can be tough. It absolutely can be tough. Robin, back to you.
And yeah, I agree with that. And that is a state decision oftentimes because they feel overwhelmed. Some states just put out all their money as discretionary and they make it all competitive, and that makes it very difficult for a rural community to develop a reliable system. We're working with AASHTO, the sort of the group that works with the DOTs, so that we can help state DOTs think about this more at a policy level and strategically. Particularly, I mean, many rural communities are distressed and there's no way they can afford it. And if you can afford it, then you're going to get the money. It sort of creates a very absurd situation so that more well-funded rural communities are better able to develop their rural transportation than distressed communities, which need it desperately. So there are no, what I would say, silver bullets, but we can work with you at developing a good grant application and making your application as competitive as possible. And one of the things that happens, I think, with rural transit is, especially if you haven't done it before, you feel like you need to go from 0 to 60 in 10 seconds or from nothing to a bus right now. There's volunteer programs, van pools, shuttle ideas that potentially can get you engaged with transportation, but not immediately put you into having a whole network or a whole system that you're working with. You can slide into it a little bit slower. And it may be, if you already have transportation in your area or in your region, you could expand the service area hours, add another route that then you would just be adding that one route instead of a whole system. So these are some examples. This is 3 rural counties in Oregon that are part of umbrella organization that is a AAA, Area Agency on Aging. And each county has a different mix of services. And through their working together, they're able to coordinate their planning, their tech, and their admin, which encourages regional access through their 3 different services. And one of the things they had is a meal site bus and a shopping bus. And these may be things that already exist in your community. If that AAA in your community is operating a meal site bus or a shopping bus, that may be something where you could work with them if they're using FTA funding to expand your grant. And depending on what your, how your state manages the funding. This is a slide that's showing the CAP Partnership for Mobility Management in Athens. This is their mobility management webpage, and you can see here is their coordinated transportation plan. Here are their partners. And I would really encourage people who haven't worked with transportation before and are thinking about that, engaging with it, to look at the Athens County Coordinated Transportation Plan. It's very straightforward. It took quite a bit of time. It always does to create change in your community, but it wasn't alone. These partners came together and they have engaged broadly with the stakeholders for transportation and mobility in their community and have done a very nice job of delivering that. Van pools are not just for, I think, yeah?
Sorry, just a sec. I want to let folks know that the HAP Cap plan that Robin just referenced is going to be sent out after this. with the slides and and posted with the slides and the recording, so that you have access to a community action-based gold standard plan. As Robin says, simple, straightforward, and readable, but it is for a very specific region, and it is one of the best of its kind. So Robin and I were both excited to discover that we already had some mutual agencies here, but this one is one that if you're starting at the beginning especially, would be a terrific one, and we will be sending it to you.
Super. I just wanted to have this example of a rural band pool, and again, this program, we work with the manager of this CATA program, and I said, hey, I'm telling people you are a great example of a rural band pool, and you can see there's a band pool handbook down there, and that's a great way to, in a sense, have instant transportation. If you have regional employment centers and you have hubs, it's a chance for you to think about working directly with employers, with enterprise van pool or whatever van pool program in your state, and get some transportation out there for everyday movement between communities. And without, the thing about van pools is you don't have to have CDL drivers. They may use smaller vehicles. I know the Washington State van pool program often has 8-passenger vans, not these 15-passenger vans. And it's another way to get something out there that reinforces your transportation network and provides resources to your community. Let's see here. Here's my information. You're welcome to call us, go to our website, ask us questions. We're having a training conference in Portland, September 15 to 18, and you'll meet a bunch of people just like you living in rural areas that are trying to figure out how to provide more access and mobility to their community. Lindley, take it away. Thank you so much for inviting me.
Oh, it's a pleasure. I won't say it's all ours because we've had a lot of fun working on this together, but the pleasure is definitely ours and the privilege. We got a couple of thank yous. I asked in the chat for any questions people might have, so I'm going to reiterate that and wait and see if a few come in. Marsha Larkin, I want to be calling her out specifically. We have used RTAP for many years. They are a wonderful resource. We couldn't agree more. And we're looking forward to doing more together as we move forward. If folks do have the questions they want to ask based on this or any feedback on whether this was useful or not for you, we really do want to hear it. You will get an evaluation form after you attend. Thanks to Amy Robert, who's also on the line with us and who has very kindly taken on helping us get that good, consistent feedback. But we are interested in anything you'd like to offer us now as I take us through the next sort of few minutes of what's coming up with the partnership, and we give you a chance to put in any other questions for Robin here as we near the top of the hour. So while we're waiting for that, Webinar Wednesdays next week is Community Action and VISTA, and how VISTA members have helped and can help community action. Robin and I were actually talking about that. If you're doing things like gathering data for an assessment, getting your maps routed into Google, as she was discussing, if you're looking at that kind of capacity building, VISTA, but also Senior Corps and others, AmeriCorps can be a terrific resource for getting a time-limited, person in there. I dare say you could probably figure out a way to couch it as match at some point. But it's a terrific way to build some capacity when you're looking around going, again, as always, we have all this work to do. Everybody's maxed out. Where do we find the space and the time to start this kind of work? An AmeriCorps member, a VISTA or Senior Corps could really be helpful. I have to take the ball from Robin. Thank you, Amy, is giving me good coaching. I want to become the presenter, so now you should see the slides for Webinar Wednesdays. So that's the pitch for AmeriCorps and VISTA. In particular, we'll be talking about that next week in some depth. Then on August 21st, Lindsay, Marsha, and I are going to come together and do a Census 2020, why it is critical that you be involved, your agencies be involved. We're actually working with National RTAP to help them get the word out to members and agencies, and think about cards that could be handed out on buses, posters, what makes sense, because we need rural America in particular. We need families. We need people of color. We need low-income people. We need people with disabilities and seniors. These are all consistently undercounted in the U.S. Census. That's who we exist to serve. That's frankly, for the most part, who National RTAP exists to serve. We need to be sure they get the word that it is both safe and important to do the census. Well, I appreciate, let's see. It would be interesting to know what other agencies are doing to get local communities, local governments, and towns willingness to seek services for their communities and constituents. Limited on funding and lack services, what works? Well, I'm going to address that by starting the ball by saying it is rather like collective impact or community level work. You got to get the right people in the right chairs at a table to talk about how this works. I'm seeing Robin nodding. If you have trouble initiating that discussion, then it's going to have to be shown. Yeah. Yeah.
Never say never. We have a world champion that we identified and awarded. We recognized a couple of years ago who got dedicated funding in rural South Carolina. Dedicated transportation transit funding. So, you think, oh my gosh, people can't afford this. They are, they're interested, but they don't want to pay for it. In states like Washington and Oregon, when it's come to the vote, in Washington, they lost state resource and they had to take it all to local votes. And 70% of the initiatives passed the first time out. And then they went back and, they've refunded, they have been able to get funding in all of the transportation districts. So it's never say never. And just because it hasn't happened doesn't mean it can't, especially with public transportation.
Indeed. There are two more here. One speaks to that. I would recommend suggesting people connect to their local metropolitan planning organization, or RPO, rural planning organization, also the local economic development agency for specific funding, and that was for CMAQ in particular. We had another one that was different from questions we had. It's very interesting, which is that one agency has a lot of existing services in our area, transit providers, van pool, et cetera, but missing some of the on-demand and ride share, so like Uber, Lyft, but also missing the first mile, last mile connections to transit. We'd like to learn more about how to provide services to our clients to get them to WIC appointments, interviews, medical, et cetera, but also provide that first mile, last mile connection for day to day. Curious if there are any case studies of rural communities, particularly trying to connect to existing services affordably. So that's a big question, but around a very specific issue. And I don't know of any case studies specific to that. Robin?
Well, I know that this has been a research issue that I've worked on with the Transportation Research Board, and that there have been several different strategies for trying to bring that on-demand trip access into more rural communities. I would be happy to provide, when we get done, Lindley can give me a list of the questions and we can respond back, and then she can post those with the other webinar materials, because we could go into this and it's very specific to a person's location and the density. The first mile, last mile issue is a huge one, and often in rural communities that I've worked with that are highly rural, people make sure there's bike racks on the buses, and many first mile, last mile trips are bike to bus, bus to bike to work. Because that 5 miles further out that beef packing plant or that small manufacturer is, it just can't be covered in the cost of a vehicle. So, there's a lot of different strategies, and I'd be happy to take that answer offline and provide more information.
Great. We have another one about folks to speak at local local planning, and I said yes, and you can get in touch with us, and we'll hook you to Robin or to other folks who can do that. Because each one, right? Community action has been built on the premise of let's help each other create these programs. Let's not reinvent the wheel. Let's share good assessments, good strategies, good funding methodologies, how we braid and blend and layer those resources, which really are three different things, right? Braiding them together is one thing. Blending them is similar but a little different. Layering is quite different. And thinking about how you do that and what comes first. It's kind of like housing or economic development. It's seldom just one stream. It's much more frequently going to be blended. I want to touch this real quickly. We are at the top of the hour to the census. Most transportation planning, and I heard this from DOT planners in a couple of states already, they rely on census data to decide where roads are going to be resurfaced, where new roads need to be. They were not talking specifically in those conversations about transit, but they were talking about how it moves their money into communities, that if the census is off, they fix roads that other roads should really be done first. And so I want to just say this deeply touches transportation itself at the federal level, as well as good data for us for baselines. Most of the maps Robin showed you owe something to census data. If it's incorrect, we are working from a false first premise. So again, please, please, please help get the word out on how important that is. You all know probably that the Community Action does training and technical assistance, as does Robin for transportation with her great organization. And as most of you know, less than 3 weeks, actually technically 3 weeks from today, we kick off the annual convention in Chicago. And we are looking forward to seeing many of you there. Please feel free to find me or anybody from the LCRC team, Amy. We won't have a huge amount of time for questions, but we can definitely do the whole hook you to somebody thing. And we'd love to meet you in person as opposed to just by webinar. Robin, let me just check for, no, there don't appear to be further questions. Several thank yous, and we appreciate that, folks. It's our pleasure and privilege to bring you this information that we think and hope will be useful to you, whether you're starting a program, growing a program, or using your program to help teach other people how to do it. We hope you found some use out of this. So Robin and her assistant Nellie Kubihiro at the National RTAP have been amazing getting us stuff. Thank you both so much for your support. We look forward to continuing to bring you these resources together.
Super, and we'll look forward to getting the list of questions and getting you some good responses. Not that they'll answer everything perfectly and that there's a silver bullet, but we'll get you the best we can. Thank you, Lindley.
Thank you, and thank you all in attendance for sticking with us. We had a very high rate of folks who stayed on the line for the whole webinar. That's always a good sign, and we look forward to your feedback. Have a great rest of your week.